Okay, may I see you get up off of that chair and walk to the door?
Just a second.
Do you need a walker?
Oh.
That's good enough. You can come back and sit down on the chair, please. And that was very painful to you, correct?
No, that wasn't painful at all.
It wasn't painful.
No.
What was the problem then in you walking? You were very slow and guarded.
Because the pride of my body tried to prevent from that getting hurt, so I timing it.
Okay, so it didn't hurt. You were protecting yourself from getting hurt, correct? Okay, thank you.
If you
Something lightly, then usually I be able to stand it. So, and a lot of time I walk on the computer, I just stand up and just stand there and just keep walking on it.
This is Yutaka and his wife April. And what you've explained to us is that you're getting severe intermittent pain. Sharp pain that's going down your leg or two legs, and you're scared to death it's going to come on, and you don't know when it's going to come on, so you're walking around very guarded. Is that it?
Yeah.
Okay. And you told me, April, that there are times when he just waltzes down the hallway, and he's fine and no pain. Correct?
Right. But it's not walking as he was before all of this. He's walking faster and better than this guarded walk that he does.
Okay, but it's not like it when it was normal. And when was it last normal?
Well,
April
10th is when the worst of this
probably
hit.
April 5th.
Okay. Now, we also know that you have root canals. You've also been to a chiropractor, and he took an x-ray of your back, and he said you have calcifications in your lower aorta, which is one reason why you're here. But now, as we've uncovered, you're here for other reasons besides the calcifications. You're here because you have this severe pain issue, correct? Okay, thank you. What were you saying to me about eating a hamburger?
If I open my mouth wide, my leg hurts.
Just to eat a hamburger
Or any large
or
item.
anything. You open your mouth wide, and which leg hurts?
Back of my leg.
Okay. Big help. Thank you.
Since April 10th.
do you want this pillow further higher?
Just like it. This is how far as I can go.
That's good. Just like you are. Terry just injected a socket. It's called number 5. Can you lay down, please? All right, now you can sit up. Okay, we can't say there's any significant change. Is that correct, or can
Now with my leg.
Okay, you can lay back down, please.
We'll inject another.
Yeah, we just did number 14. Can you sit up, please? And lay back down. Can you say if there was any change?
It's easier to lay down.
Now there is?
Yeah.
All right, we're going to do one more. Can you sit up, please? All right. Can I see you walk?
You want your cane?
No. Okay. Can you lay down for me, please? Okay, you can get up.
And it's faster than normal?
Yeah.
Is there any change in the back of your leg?
A little bit.
Please get up and try to walk to the door.
does hit right here hurt.
It hurts?
Yeah.
Is there any change?
Well, yeah.
Yeah?
Not as severe?
Not bad as earlier, but same time this muscle is real tight right now.
But it's better.
Mm-hmm.
Great.
Okay.
Well, you can walk backwards.
Could he walk backwards before?
I don't think so. Not without being very unstable.
Do you see a difference?
I see it.
Utaka, how much less pain do you have? 10%? 20%?
Yeah, 10%, 10 to 15%.
10 to 15%. Not any more than that.
No,
Okay.
Could you walk backwards before?
Without the cane.
not that much.
Okay.
So that's better that you can walk backwards.
Terry just injected number 28, which is a root canal. Can you get off of that and walk to the door, please? You can't. Are you in pain? Did that hurt?
No. It's just how I put the weight on.
Oh, it's how you put the weight on.
Uh-huh.
Okay, you can come back.
Actually,
good.
walking backwards is easier.
So what happened after 28? After the
Not
last
much.
injection? No?
Okay, Terry just did a root canal in number 32. Can you get up and walk? Okay,
It's
now,
alright. It's alright. This is the hardest part to getting up. As soon
Okay.
as I can put the weight on there, I can move.
It's initially when he, after. When we're gonna go dancing tonight?
No, only way I can do that, I have to rest my butt.
okay, can
Oh,
you
yeah.
walk? Can you
Is that
walk to
better?
your wife now?
Is that better when you got up from sitting? Good.
Right now, the muscle is real tight. Yeah,
Okay.
muscle.
Hey, can I see you get up and walk to the door? You can use your cane. Okay, you can come back. April, are you noticing anything different in what he's able to do? Is it significant in your eyes?
I think so. How are you feeling, Tucker?
You just told me that the pain is gone, but the muscles are still tight. Is that accurate? But the pain is gone.
So right now, earlier when I tried to stand up,
It would be painful. That's the hardest is when you're going to sit up after stand up after a sitting position.
so it's this position to get it up the point. That is probably the most painful thing I've been dealing with.
That's the most significant change.
And there's no pain now when you got up?
Well, it does have a pain a little bit still,
How
but
much better is it?
1 to 10?
it's hard to say.
Not a 10.
Maybe 5.
That's significant
That's
for me.
significant,
That's
yeah.
to me, that's very significant. Turn your head side to side, please. That's better. Turn it back. That's much better.
Yeah.
Okay. Bend your head back as far as you can go, and bend it down. Okay. I would say that's significantly better.
I agree.
Wouldn't you?
Yes.
There's no question about it. Okay.
Especially going back.
Especially going back. Yeah, you couldn't bend your head back before. Do that again, please. Yeah, you had no extension before. Okay.
Got affected your
32.
32.
You just told me that back tooth, number 32, that got an infection 6 months ago, and that started everything.
That started at March the 5th
This year.
this year.
Yes.
I took an antibiotic
Oh.
in March the 6th because I went to dentist on the March the 6th. And March the 7th, I had to be at the Indiana, so I didn't want to have to deal with a toothache. And that was March the 7th, 8th, 9th, and 10th.
With the antibiotics.
Antibiotic. When I came back, all these things started.
Very important. Okay, let me see you now. Walk to your wife, please.
And then dentist wanted to pull it. And I
Well,
told him, oh,
you might have been better off with it pulled. Okay, you can come back.
So that tooth is still in there.
yeah.
It should have gone.
Okay, you can sit down. The level of pain, you were not struggling at that just now. The level of pain is significantly reduced, yes? Can I see you lay down, please?
Oh, God.
Okay, now you can get up.
Other than the funny face, you weren't moaning in pain. It seemed smoother, was it?
Well, it is.
I noticed the same thing. He made a funny face, like he was anticipating a problem, but he went down very fast,
Smooth.
very fluid, and he didn't moan. So I think right now we're on to something.
I think so.
I think the teeth are going to have to be looked at, and your sacroiliac, hopefully we can treat with what Terry did, which is an injection of ozone into the joint. All right? I would like to be able to use this for teaching purposes and post it on YouTube. Is that okay with you and you?
Absolutely.
Thank you.